So, the hamstrings come off this ischial tuberosity right in the midline of the posterior leg, right where it meets the gluteal fold usually. And they split and come down and cross the knee on either side. The biceps femoris grab the head of the fibula. So my tendinosis is here on the present screen, and membranosus just above it on the condyle. For palpation, I usually am using a simple flat palpation and strumming across the fibers. So if I'm thinking about biceps femoris, I'm going to strum like this and look for tender spots, the taut bands right in here. There's a pretty good one in here. So grab ourselves a needle. In general, either side, I needle away from the midline of the leg, because right in the midline is the sciatic nerve. Deep needling towards the midline is more likely to run us into it. So I'm going to angle a little bit lateral. And these are not super deep muscles, so I'm not trying to bury it super deep. Simply. If you're worried about the biceps femoris short head, you're going to be in the distal third or so of the posterior aspect of the femur. Again, we don't want to be straight on the midline, we're just off to the side. We're going to be pressing in kind of deep. Grab another needle here. Again, angling slightly away from the midline in this position. And this one is a little deeper, so you're going to need to needle a little deeper. Is that okay? Gildan.
Yeah, I didn't hear you. I didn't know you were talking about it. Yeah.
No worries.
Yeah, they're all good.
That's biceps femoris' short head. You can needle all of them at their combined tendon at the top. Likewise, you can needle the insertion at the head of the fibula. When I'm needling the superior aspect, it really doesn't matter the direction, but I tend to needle from lateral to medial because I feel less like I'm sticking my hands in their butt trying to get medial. Though sometimes I will do it straight in. I'll just come just below the ischial tuberosity and needle up towards it like this. That's okay too. It's very sticky feeling in tendinous material. So it'll feel like you're moving through something gummy and sticky. That's the ladder 36 or the combined tendon for the hamstrings. The semitendinosis and membranosus aren't hard to find, but people often fall off and they're over here where we were for magnus. So we want to realize they're not super medial in this proximal portion, they're more midline. So right in here is more where we want to be feeling for tender bits. Yeah, there's a good one there. So I'm going to aim just slightly away from the midline of the leg towards the midline of the whole body. Try not to put myself electrical.
Burn. Just burn.
Okay. Is it fading?
Yeah, gone.
Just like we're needling in the proximal portion, we can come down here and feel in the distal. And a lot of times just behind vastus medialis here, where it's kind of ropey on top for tendinosis, is a good spot to needle and find trigger points. And it may be the membranosus underneath. Not super deep, so I'm not trying to drive it in, but I am trying to steer clear of the midline. Realize the closer you get to the knee, the more lateral you need to be. This triangle here that is the popliteal fossa is danger zone, even though ladder 40 is right in the middle. Yeah, if you can feel a pulse, you can be really safe in the popliteal fossa, but